Hello. So you're our famous boss.
At Medical Systems of America, we have developed the most effective measuring device of impairment and disability available today.
We've got a new product out that is able to test people while they're in motion. Our machine was developed by some of the greatest minds in the IT industry. They were able to write software that mimics our equipment, which in turn is how we're able to measure the range of motion.
The Achiever performs functional capacity testing through range of motion, including flexation, abduction, and extension for evaluation and documentation purposes. Unlike most machines on the market, testing with the Achiever may be done through both isokinetic and static exercises.
The reason I bought into this company was because coming from an athletic standpoint, I played sports for years, and while I was playing, I went through several injuries, and they actually could have been prevented if I would have known around what time, it would be safe for me to come back and play again. And when I saw this machine and I saw that it was capable of, not only telling me if I'm injured or not, but telling and revealing, when somebody's able to return, whether it be returning back to the sports field or returning back to work, I saw that it had huge potential, and the need for this is truly great.
Each year, workers' compensation claims cost employers billions of dollars due to increased premiums, lost productivity, and retraining. It is possible that only one claim for $5,000 could require $250,000 in sales to gain the profit required to cover the increased insurance premium cost. Studies show that up to 80% of the increased cost of workers' compensation comes from new claim filing. What if you could determine if a potential employee is a compensation risk prior to hiring them? With the Achiever, employers can establish pre-employment fitness tests by setting a baseline workforce a potential employee must pass.
There are several types of companies and businesses that can benefit from the Achiever diagnostic testing. It can be used for pre-employment. You may have a company that does distributions and they have people who lift items. You want to make sure that person's in the right position before you hire them.
With the Achiever's unique ability to move both vertically and horizontally, allowing for multi-plane testing, an applicant can be asked to perform a specific movement for a total torque curve versus testing one specific muscle or static movement. This can not only determine if the applicant can physically perform the tasks required, but may also help prevent previous unreported injuries from being attributed to your business. Employers can also test back-to-work readiness after a claim to prevent further injury. This multi-joint movement testing is exclusive to the Achiever. Physicians, physical and occupational therapists also benefit from the Achiever. Often called upon by insurance companies to evaluate and rehabilitate patients with workers' compensation or automobile accident claims, the initial evaluations are often time-consuming and difficult to establish results with accuracy.
People with disability, they've always had tests by a doctor that's shown the doctor's opinion. Now we have that objective testing that can show, yes, this person really is injured.
The Achiever obtains accurate measurements with a string gauge, giving you, the provider, an easier, safer, and more effective way of computer graphing a patient's range of motion. With its multi-plane testing capability, physicians can complete a functional capacity evaluation of both the upper and lower extremities. The Achiever enhances the provider's income with a safer method of continuing a patient's isokinetic rehab program with less patient exercise time and less of a time commitment from the provider because of its safety advantage. Patients are motivated as they can visually track their weekly progress through the Achiever's compatible graphing software.
The Achiever is unique because of the software. The machine itself, we test the range of motion, and it's not by weight, it's just by resistance. But the software lets us know if there's truly an injury and where it is and what a percentage of the injury is.
What what it's able to do with it being so sensitive and picking up every little detail that's happening is say we got somebody injured, when we have them go through an exercise, they're going to have a glitch within that range of motion. It's going to be so slight that it may not be obvious to the human eye, and most of the time it's not. And those little sensors are going to be able to pick up on the slightest detail. So when that glitch happens, it's recorded. It's recorded throughout the range of motion. And most of the time, like, we'll ask our patients to do the same exercise over and over again. That way, when that glitch is happening, our software is picking it up in the same exact spot each time. Usually when somebody who is truly hurt, you're going to see that glitch happening in the same spot, same location within that range of motion each time. And our software is able to print that out in a bell curve graph. That way it's readable to us, and we're able to point out and pinpoint the exact location of the injury.
We're the only ones that have the objective testing.
Unlike all other testing machines on the market, the Achiever comes with software that is already set up with CPT coding and all supporting documentation for insurance claims, streamlining paperwork, saving you time and money. Insurance companies themselves also see advantages with the Achiever's evaluations. Whether it be evaluating for workers' compensation or automobile accident injury, the Achiever can accurately determine the true injury and recovery of a patient, important for insurance settlements and payments.
One of the biggest questions that was asked to us when we first designed it was, can this thing be cheated? Because if it can be cheated, you know, the validation of the whole thing is lost. We actually had the software developed to read the equipment for years, but we knew it would be no good without a cheating system. It took us several trials, several adjustments, but we finally came up with what we call a CV, coefficient variation. And what that is able to do is read each pull that a person is doing. And if this pull or this range of motion that we take them through is not completed the exact same way each and every time, we have an indicator that pops up. Say somebody comes in here who does not have a significant injury and they're wanting compensation for it. You're going to see them do things, you know, half slack. You know, you're going to see them pulling it. And I mean, you a lot of times will know that they're not giving a full effort, but how is it that we're able to tell if they're not? I mean, you can't really accuse somebody that they're not really giving a valid effort. So our CV is able to, within each range pull, is giving us, you know, an indication of whether this person is given a significant effort within the exercise.
The Achiever is the most effective total evaluator on the market today. Most ranges of motion vary from 50 to 100%. With the Achiever, this strength variation is perfectly accommodated to each and every patient, regardless of his or her health or strength on any given day. The Achiever accommodates injuries and is safer than weights, as it does not limit what the patient can move at their weakest point in that range of motion. Patients actually make an exact amount of resistance that they can exert as they pull on the unit. If they exert 2 pounds effort with a wrist injury, then they get 2 pounds of resistance. For example, if a patient's prescription is a rotator cuff exercise and can only exert 5 pounds for the first 10 degrees, but then can exert 10 pounds for the next 10 degrees and 20 pounds for the balance of that movement, our isokinetic exercises overcome this limitation automatically. But with weights, patients would only use a 5-pound weight and get little help for the stronger ranges. There is no resistance to set or release with the Achiever. Our machine is always adjusting to the force applied to automatically alter resistance as the patient fatigues safely, which is important to both patient and provider. With the Achiever, we not only show and graph the weakest point, but also show the strong or peak point throughout the full range of motion, thus not only recording peak point, but also providing a total work amount for the full range of motion.
You're going to have an honest report of your capabilities, your functional capacity. If you're looking for an honest, true exam, we're the only ones who can give it.
Businesses that have benefited from Achiever Diagnostic testing include insurance companies, athletic clubs, attorneys, corporations, hospitals, rehab facilities, state and local government, and we are even Department of Defense certified.
We've been marketing to attorneys, to doctors, to anybody in risk management that is in need of a service that is able to tell them whether somebody is truly injured or not.
Dollar for dollar, this equipment is light years ahead of any of its competitors. Achiever Diagnostic Testing is confident that you will not find a product on the market to better serve your evaluation needs. MSA 12 Achiever Diagnostic Testing is conveniently located off I-40 in Clemmons, North Carolina. Call us today for more information and our competitive pricing.